The purpose of this video is to have a variety of some of the most innovative techniques that have come about in hair restoration surgery over the last 25 to 30 years, a time that happened to have coincided with my practice in hair restoration following my fellowship with Dr. Kabaka. Innovation is wonderful as long as it doesn't compromise patient care. And there's a very fine line that a surgeon, an innovative surgeon, needs to walk. You want to bring in the best of new techniques, but at the same time, you don't want to make sure that you're not innovating merely for the purpose of saying you have something new, rather than creating better results for patients. Another hard aspect is for particularly older surgeons to acknowledge when things can be done better, but to say, well, it worked well with the techniques I've been using. So that's another side of the sword of innovation. I think Dr. Kabaka was in his leadership vision to go out on a limb back when hair restoration surgery was clearly the very, very poor stepchild. He used to call it the used car salesman of plastic surgery because the techniques were so inferior. But an innovator, as well as a leader like Dr. Kabaka, saw that potential for improvement to the point where certainly I would argue that hair restoration surgery is on a par with the other plastic surgery procedures. And in some cases, I think the results that we achieve are superior to those and on a more consistent basis than that achieved with almost any other plastic surgery procedure. Some of the more innovative techniques that have come about and that have been perfected over the last 25 years, most notably has been a product of the creation and the perfection of the technique of FUE, or follicular unit extraction. FUE involves the individual extraction of hairs one at a time. It obviates the need for a large team of assistants, obviates the need for an incision, donor site incision in the back of the head. And you can see there's a variety of ways that these FUE grafts can be harvested in terms of how much is shaved. The traditional way is shaving the entire back and sides. Something that I've worked on along with several of my other colleagues is what's called a no-shave technique, where hairs are able to be extracted with just trimming of the hairs that are removed, essentially allowing patients to be presentable the very next day. Other innovative techniques in hair transplantation have been the use of smaller and smaller recipient sites, as well as the use of implanters that allow grafts to be planted into these small recipient sites without the need for large, clumsy jeweler's forceps. Also, smaller grafts, more refined techniques have allowed for the truly aesthetic restoration of eyebrows and beards and other boutique procedures. At the same time, FUE has also allowed for reparative techniques, and unfortunately, with the growth and the popularity of FUE, basically the limits as to who could do it have significantly dropped. You no longer needed to have any surgical skills, just know how to use a little punch device or a drill device, which is many times is delegated to assistants who have really no business or no ethical commitment to the patient to do no harm. They never took the Hippocratic Oath, and they're not under the supervision of physicians. So there's issues, and we see this poorly performed hair transplants, which require reparative work, with which FUE, in the case of this, FUE removal allows actually for the removal of grafts that were planted prior that aren't aesthetic. I'd say finally, outside of the medical therapy advancements, everything from more cell-based therapies and some of the laser light and other energy devices. Other main innovation, which was largely a product of the work of Dr. Kabaka, is the hairline lowering surgery or forehead reduction surgery, in which a hairline, an existing frontal hairline, most commonly in women, because it requires a stable frontal hairline, can be advanced by as much as an inch or more in a single 2-hour-long procedure. Lowering the hairline, trichophytic incision permits hairs to go through the scar. Hairlines can be lowered, not just lowered and boxed off, but actually rounded out. And this has been a significant advancement. As a plastic surgeon in particular, we're unique in our ability to be able to offer this because it is a surgical procedure. So I think that that's where both the innovation and the ethics can come in to do the right thing for your patients, be innovative, and of course, as a leader, to teach your technique to others, to allow other surgeons to basically raise all waters, rising waters raise all boats, to be able to deliver this, not only educate patients and surgeons and other hair doctors that this technique is available, but also to be able to offer it in a safe, with safe outcomes, consistent outcomes to more patients.